Good afternoon. Since Wednesday, May the 6th, we have seen a 7% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 2,941 reported cases, 394 people hospitalized with COVID-19, and 139 deaths. We remain focused on continuing to scale up our responses to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. Over the last month, we have stood up a new call center staffed by healthcare professionals to provide residents with the most up-to-date and accurate information. We have also launched an expanded dashboard which provides residents with essential information around this pandemic, including racial, gender, and age demographics, as well as testing site information and food access information. The new page also features a live chat option, providing residents with another avenue to get verified COVID information. We rolled out a broad-reaching advertising campaign. We have also launched the COVID-19 Small Business Assistance Initiative and the COVID-19 Small Business Task Force, which represent the first steps of many in Baltimore's continued recovery and eventual reopening. We also developed an emergency COVID-19 discount program for all Baltimore City water customers. We've also launched 3 testing sites in the city: Pimlico, the Rollin Conservatory at Drew Hill Park, and Lake Clifton Park. And earlier this week, we launched the TRI Support Initiative in partnership with UMMS and the Lower Baltimore Hotel, which will provide triage, respite, and isolation services to individuals with moderate or mild COVID-19 symptoms who are unable to self-isolate where they live and do not require hospitalization. All of this is in an effort to provide residents with the needed resources and to help keep them informed as we progress through this public health emergency. I want to remind residents that they are encouraged to call their doctor or 211 for corona symptoms screening and to be connected to a physician for assessment. Today, the emergency COVID-19 discount program goes live. I want to thank the entire Department of Public Works team for working tirelessly to bring this discount program together at such a crucial time. By making this program available, we are taking aggressive steps to ensure clean and safe drinking water is available and affordable for all of our residents. The discount program will provide the same assistance that eligible BH2O Assist and BH2O Plus participants receive: a 43% discount on charges for water and sewer usage, and a waiver of bay restoration and stormwater remediation fees. Water bills will resume today after delays due to the city's pandemic response, with customers receiving larger than normal water bills that include part of March and all of April. Late fees have not and will not be assessed for overdue water bill payments, and water has not and will not be shut off for lack of payment. The emergency COVID-19 discount program will remain in effect until 90 days after the end of the current state of emergency on December the 31st, 2020, whichever comes first, and the discount is good for 1 year. To apply for the program, residents can go to cityservice.baltimorecity.gov/BH2O or BeMoreChildren.com/BH2O. That's cityservices.baltimorecity.gov/BH2O or BeMoreChildren.com/BH2O. Applicants by mail will also be accepted. Also today, I'm announcing the Phase 1 reopening of certain activities at Liberty, Loch Raven, and Pretty Boy Reservoirs. As long as residents continue to practice social distancing, these activities will allow residents to get outside and get exercise. But we still need residents to remain mitigation practice while doing so. The Phase 1 reopening will allow the following activities to resume at the reservoirs beginning at 8 a.m. on Saturday, May the 9th. Hiking, biking, kayaking, fishing from the bank, fishing, boating, and horseback riding. Fishing from the boat platforms will remain closed, and Loch Raven Drive will continue to be restricted to pedestrians' activity over the weekend. All watershed regulations will be enforced. Boating and fishing registration and permitting must be current. I know I probably sound like a broken record because I keep saying the same message every week, but it's that important. We need everyone to stay home unless you need to go out for essential reasons. If you must go out for an essential reason, everyone should be wearing a face covering. This covering isn't for you, it is to protect everyone you come into contact with. It symbolizes that you care about your fellow residents. And I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. You have literally saved lives. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. Now I will ask Baltimore City Health Commissioner Letitia Zavasa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to our partners for their continued efforts to support Baltimore City during the COVID-19 pandemic. Tomorrow, in line with the state of Maryland's reopening of public beaches and parks for exercise, Baltimore City will be opening some of its reservoirs to the public. Safe outdoor activities at the reservoirs include things like biking, running, kayaking, fishing, boating, and walking your dog. However, while residents are now able to do more physical activities outdoors, our social distancing and face cloth covering guidance remains in place. If you and your immediate family are thinking about going to a park or reservoir for exercise, be sure to keep 6 feet of space between you and others. Wear a cloth face covering over your nose and mouth. Bring hand sanitizer with you to the park and wash your hands frequently. As a reminder, please be sure to visit coronavirus.baltimorecity.gov for the most up-to-date case data and COVID-19 frequently asked questions. Residents can also call 211 if they have mild symptoms of COVID. Those mild symptoms now include cough, fever greater than 100.4, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. 211 can connect residents to clinicians who will perform an assessment over the phone, and they can also connect you to a testing site for further evaluation if necessary. 211 is a resource for questions for those that might be curious about coronavirus, even if you don't have insurance, or for those who want to understand next steps that should be taken if they're experiencing mild symptoms. 211 is not a replacement for your primary care physician if you have one, nor should it be used if a resident is exhibiting severe symptoms that require emergent medical evaluation. If you're in need of immediate medical attention for life-threatening symptoms like discoloration of your lips or face, severe difficulty breathing, chest pain, or extreme difficulty arousing, please call 911 immediately. Finally, this week, the City of Baltimore released infographics and social media around contact tracing, an important tool that public health organizations across the country are using to minimize the spread of COVID-19. The Baltimore City Health Department has a team of contact tracers working 7 days a week to support city residents. Our team of contact tracers is reaching out to residents who have been exposed or may have been exposed to COVID-19. They ask about residents' movements, who they have come in contact with while they were at risk for spreading disease, and provide advice around isolation and quarantine if necessary. If you receive a call from the Baltimore City Health Department or one of our partners about contact tracing, please take it seriously. It's not a scam, and we will never ask you for credit card information, immigration status, or social security number. Instead, we are asking you to participate in our contact tracing efforts to help the city track and minimize the spread of COVID-19 and to help flatten the curve in Baltimore. Thank you.
Thank you, Dr. Sarasa. Now we will take a few questions.
Mayor, has there been any thought to opening, I've gotten a lot of questions like how about put the rims back up on the basketball courts? Has there been any consideration given to that?
No, not really, because that would be too close. On the basketball court, you can have a number of young people out there, and they probably won't be practicing social distancing because they'll be playing against each other. Like I keep referring to, whatever our healthcare professionals advise us to do, that's what we're going to follow. And doing the reservoirs and those other activities. People are spread out widely. It's not like they all congregated like on a basketball court. And as long as they follow the social distancing requirement that we have, I think it's appropriate for those type of places to be open. But basketball courts and playgrounds, no, not yet.
Mayor, can you outline your concern, if any, for the situation at City Hall, the employee or someone who was tested for COVID-19?
Well, you know, to be honest with you, I had no idea that there was a possible case of somebody, you know, showing symptoms. The first thing that the president and his staff should have done was to notify our health commissioner and the Office of Emergency Management so that they could have, you know, did what they normally do. I don't think he did it maliciously. I think he just didn't know. So I'm hoping that we don't make those kind of mistakes again, because we all was up there in that room and had no idea that someone was showing symptoms of COVID-19. So it put all of us at risk.
You happy the way you handled it?
Yeah, you know, I sent him a letter, you know, telling him that, you know, he should have notified us and let us know, because we had everybody at the news meeting. You guys were there, you know, all of us was there. And we don't want to put anybody at risk. So.
Anything else? Do you have a plan for reopening?
Well, you know, we're going to follow the guidelines of our health professionals. You know, the governor have relaxed some restrictions, like the ones I just cited, where people can go boating, fishing, and those kind of things. But we want to make sure that we really, really are slowing this curve before we say, yeah, let's open up this and open up that. Yeah.
Do you find yourself having much disagreement with the governor on the reopening tactics, or are you kind of?
Well, you know, his people have been, you know, letting us know some of the things, but sometimes we find out when you all find out, you know, which we already have spoken to his people that we want to be included when he's talking about reopening, so we all be on the same page. You know, we don't want to be scattered.